Good afternoon. I'm Tylor Escobar, and this is Germany, a brief analysis of German health status. So here's a little bit of an overview about what I'll be covering today. I'm going to talk a little bit about where Germany is at in relation to Western Europe. We're going to cover what type of country Germany is, some German health system components, as well as German health status. I'm going to cover some advancements that Germany has made in the past 40 years. We're going to compare Germany to a peripheral country. I'm going to talk about what lies ahead for Germany in relation to its population pyramid. We're going to do some advantages and barriers that Germany faces, and I'm going to talk to you a little bit about some public health priorities for the future. So where is Germany? Well, as you can see right here, I've got a map of Western Europe. We've got Germany here in the orange with Belgium, France, Switzerland, and Austria as highlighted peripheral countries. And now let's take a closer look. So Germany is a mature federal parliamentary republic, and it consists of 16 federal states. And you can see here that the 16 federal states are all outlined here in this map. Well, what type of country is Germany? Well, it's the fourth largest economy in the world. The third largest economy right now is Japan, and the fifth largest, coming right up on Germany's tail, is France. Germany has a large total population at above 81 million. Has a relatively high annual GDP per capita at just above 41,000. They spend quite a bit on health each year. They spend 8.7% of their public expenditure on health, which in comparison to some other countries of interest, let's say the US and Switzerland, is quite a bit. The US spends 8.5% of its public expenditure on health, and Switzerland pays 7.1%. So Germans spend quite a bit on health, and we'll talk about why that is in just a few slides. Their unemployment rate, as you can see, is relatively low at 5.5% compared to the US unemployment rate at 8.1%. Almost all Germans are literate at 99%, and I also read a study during the course of this that 80% of the working age of the population has at least a high school education. And I'd venture to assume that quite a few of those individuals also have college educations. And what does this all lead to? Well, this leads to high life expectancy in Germany at 80.8 years. So what's the verdict? Well, the verdict is that Germany is an affluent nation. And because they are an affluent nation, and because they are so densely populated, and also because Germany is so large in relation to its overall square footage in Western Europe, they have a big impact on their peripheral countries. So they really impact the economy and the health systems of peripheral countries. But with this affluence that Germany has comes certain health concerns, and we're going to talk about those. So what makes up German health systems? Well, Germany has a national health system, and 90% of German citizens choose to use this system. And what their national health system is it consists of sickness funds, which are what they refer to them as. We would call them just insurance companies. And what these sickness funds do, and there's over 240 of them, they cover health insurance at a very low cost to German citizens. They have very low copays. A video that I watched said that they pay maybe $15 every few months, which is very, very low. Not everybody has to use this system. The rich can opt out if they want to, and these sickness funds pay the physicians in the facilities. So all the funding from the physicians in the facilities, or mostly all of it rather, comes from private funding. So how do they do it? Well, these sickness funds are paid about 50% by the employer and about 50% by the employee. And all the premiums are based on income. So a person that makes, let's say, $30,000 a year spends a whole lot less money on their premium than a person that makes $85,000 a year, which is the way it should be. And here I've got, I should have bolded this, but this really is the keystone, if you will, of why health systems in Germany are so successful, and that is that insurance companies are not allowed to make a profit. And that's a government mandate. They just can't make a profit. They can on additional things such as additional life insurances and additional policies, but on your standard medical insurance, they can't make a profit, which is key. And at the beginning of the year, the federal regulations predetermine medical costs. Physicians are, of course, paid less because of this, but that's a necessary evil. And medications cost less in Germany as well, much less than in America. And another component of Germany that's very, very important is that they're very resource rich. And by resource rich in the health sector, I mean that they have a very, very large number of hospital beds per 1,000 population. The only two countries that have higher than 8.3 per 1,000 in terms of hospital beds are Japan and Korea. Everybody else is lower than that. They're very physician rich, as you can see, and they're very nurse rich. 11.4 practicing nurses per 1,000 population is very, very rich in the nursing sector. They have very low infant, neonatal, and under 5 mortality rates. And right now we're talking about German health status. Their contraceptive prevalence is very high, and their fertility rates are very low. And really this is indicative of high average annual incomes for families in Germany. This is indicative of advances that Germany has made in the terms of medical care, medical facilities. Women now have greater access to perinatal care in Germany, as well as just general advancements that women have made in German society in regards to their social and their political status. So all of this combined means that Germans in general have good health. They have good health insurance. Their health insurance is very comprehensive. And by comprehensive, I mean that German health insurance is also very keen on alternative medicine, such as homeopathic medicine. And German health insurance may be just as likely to send somebody to the spa if they're very stressed or if they're suffering from depression as they are to give them pills, and that's really, really good. They also have very low HIV and AIDS-related deaths, very low, fewer than 1,000 per for the population. So that's all fine and dandy, but how do they compare? How do they compare to peripheral countries of interest? And the country that I chose to compare them to is Switzerland, because they have a pretty similar economy. They're both developed nations, and their governances are pretty similar as well. So as you can see here, I've got that Germany's life expectancy is 80.8, and we covered that before, which is a little bit higher than the OECD average, which is an average of 34 different countries of 80.1, but it's lower than Switzerland. Switzerland's is 82.8, which is quite odd if you look here that Switzerland has higher neonatal mortality rates, under 5 mortality rates, and infant mortality rates. And their HIV prevalence is higher, and their maternal mortality ratios are also higher. So if all of these negative health indicators are higher in Switzerland, why do the Swiss live longer? And I did some research on that. I tried to kind of come to the root cause of that question there, and I really can't, so it's still a mystery to me, but it's a really good question to consider. So what kind of advancements has Germany made since 1970? Which is the earliest that I could find information on this. Well, as you can see here, the negative health indicators in Germany, such as infant mortality under 5 and fertility rates, are extremely high. We got 22, 25.6, and 2 respectively. And then when you look at them in 2010, it's a drastic change. We've got infant mortality rates that have dropped 18 points, under 5 mortality rates that have dropped over 21 points, and a fertility rate that's dropped quite a bit as well, which of course raises the overall health status. And when you look at this on a curve, this isn't something that happened overnight. This is something that was a gradual decline over the course of these 40 plus years, and it's something that declined all across the board. It wasn't just infant mortality rates that declined, it wasn't just under 5 mortality rates or fertility rates. Everything declined, and everything declined within the age brackets at a relatively similar level. So what causes these health advancements? Well, we talked a little bit about the advancements that Germany has made in terms of their medical care and their medical facilities. I talked a little bit about German advancements in their living conditions, as well as the advancements that German women have made in German society. But there's also public health initiatives that have contributed to this, and health sector resources, the fact that they're very resource rich, That's also contributed to this. And I also said that smoking prevalence is a contributor to this. And the reason that I bring that up is because although Germany is not smoking as much as they were, they've gone down about 8% since 1978. Still 21.9% of the population in Germany smokes, which is very, very high in terms of some other affluent nations. For instance, the US, in Austria and Sweden are about 5 to 10% less in terms of their overall smoking status. So what lies ahead for Germany? Well, Germany's population is aging, and they're aging at an alarming rate. And an enormous portion of their population, 40%, is below the age of 15 and above the age of 65. And those, of course, are the individuals that are not in the workforce. And what does this do? This creates a burden on middle-aged workers. So here's a population pyramid. As you can see, this is a contracting pyramid, and it's roughly equal on either side, male and female. And as I said here, or as I said in the previous slide, below 15 here, there's a pretty large proportion. And above 65 here, there's also a pretty large proportion, which means that in the years to come, this middle age, these middle-aged workers here, are going to shift, and they're going to make up the older population. And this is going to cause some health concerns for Germany, as we'll see. And as I talked about, it creates a burden on the middle-aged workers, and it does this because the middle-aged workers are becoming fewer and fewer, and the people that are drawing from social services, the social service dependents, are growing in number. And this also creates a strain on Germany because their demand for their long-term care services is going to rise. And by long-term care, I mean hospice care, I mean long-term rehabilitation facilities, and home care. And this is all because a greater amount of chronic diseases is the result of an aging population. So what are some barriers and some advantages that Germany faces? Well, the key factor here, and really the key point throughout this, is that Germany has an aging workforce. They have an aging population. And one of the advantages that Germany has in terms of humanitarian is that they can foster migration. And by migration, I don't just mean migration of anybody. I mean migration of skilled workers. So if they bring in more skilled workers into their population from varying other countries, they can help to offset their aging workforce. They also need to focus on eco-innovation. Recently, they have banned nuclear power, and I find that as a barrier. So they need to focus on eco-innovation and strive to be a leader in eco-innovation in the future. And they can also do something very simple, and that is they can raise the labor participation of females and older workers. That'll help to offset that aging workforce. So what are their public health priorities? Well, they need to address the needs of an aging population. Aging populations, of course, are going to need to be cared for. They're going to need long-term care facilities. A greater impact is going to be made on their medical facilities. Chronic diseases such as ischemic heart disease, cerebrovascular disease, and cancers are all going to be surfacing more and more at an alarming rate in Germany. And these are all going to need to be addressed, as well as they need to address the rise in obesity and obesity-related diseases. Because Germany is an affluent nation, obesity is on the rise, and Germany may have lower obesity numbers than America does, but that doesn't mean that it's immune. Germany still has high obesity numbers, and they need to help combat that. And they also need to address the preventable diseases like lung cancer from smoking and cirrhosis from the liver, etc. So let's wrap this up. Germany is an affluent nation. We covered that. Their health systems are very proficient. They're well accepted. They enjoy a high level of health because of this. They've improved a lot since 1970, but they still have some barriers to overcome, especially in terms of their aging population and their aging workforce. And the public health priorities in the future are going to focus on diseases of an aging affluent nation. And that really sums it up there. They are an aging affluent nation, and they're going to need to focus on those issues. And that's it. Any question?